Welcome to the Experience Health Podcast. I'm your host, Rachel Vassar, an online holistic health practitioner shifting the paradigm on healing chronic disease, gut issues, and fatigue to help high achievers overcome weight loss resistance and experience health. Today's guest, I'm so excited, is someone who brings a powerful voice to a topic I'm incredibly passionate about: root cause healing and nutrition. Dr. Elizabeth George is a retired pathologist with over 30 years in clinical medicine and the founder of Healthy Eating Adventure, a community-based program that empowers people to embrace plant-based eating as tools for disease prevention and healing. She's also the co-author of Healthy Eating Adventure, out May 21st, which shares her mission to close the nutrition gap in medicine. After years of seeing the long-term effects of chronic illness, she became frustrated with a system that medicated symptoms instead of educating on lifestyle and nutrition. So now she's on a mission to bring real food back to the center of healthcare. Dr. George, I'm honored to have you on the show. Welcome.
Thank you. It's great to be here. Did it really say pathologist in my summary somewhere? So I'm
I
a
think
family physician.
physician?
Family.
Okay, interesting.
Yeah.
It
I
did
was
say pathologist, I
so-
believe. So that's funny. I was a little bit
family
confused
physician,
there, but I was like, okay.
which even more enrolled me into what I was doing because I was watching the health of my patients over the years on the standard American diet. And so
Mm.
that's kind of brought me into it. Yeah.
Oh,
Mhm.
love it. Love it.
Yeah.
Yeah, I'm super
Oh,
excited
and
to.
the book title, it's Healthy Eating Adventure, but it's the science, success stories, and recipes for whole food plant-based eating. It's got a
Oh.
subtitle.
Oh, a subtitle. Okay, beautiful. Yes. So that'll be out May 21st, correct?
Well,
Amazing.
yes, it should be.
Yes, it should be. Okay. So if you guys are interested, definitely follow her. Do you have social medias?
Yeah,
Yeah, follow.
yeah. The
Yes, follow her on social medias to.
healthyeatingadventure.org is so it's easy to remember. Yeah.
Yes.
You.
Yes. Okay.
Yeah.
I'll have it all in the description below so you can get her book when it comes out, which will be super exciting. Congratulations. How long have you been working on that?
Oh, I don't want to say. No, well, we were writing it for a year or so. It's a co-author, Chef Nick and I wrote it together, and
Oh,
then
nice. Yeah.
this editing and layout.
Yeah.
Da, 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 da.
Yeah, I know it's a whole process.
It is.
Definitely. But that's so exciting that it's almost done. Are you pretty much doing like finishing touches right now? Is that what you said? Hopefully May 21st?
Yeah, no, actually, it really is. It's actually
Oh,
been
okay.
put in, so yeah, it should be. I've just gotten so used to saying hopefully.
Yeah. No, that makes sense. I totally get it. Well, that'll be super exciting. I'm
Yeah,
really, really happy for you.
thank you.
So I would love to start kind of at the beginning. I know you mentioned that you were a physician, correct? You were a physician
Family
for
physician.
30 years.
Let's see. That's
Um,
math. Yeah.
yes. So what did you witness in your career that sparked your passion for nutrition?
I think I actually always had a passion for nutrition. My mom was very conscious of it and a label reader and everything, and we were healthy eating. So I always tried to introduce that all the years I was in practice, and found that really my patients ended up on fewer medicines because they were making the lifestyle changes, but we hadn't come into things still got worse and worse over the years as the standard American diet just, well, as just went crazy. So, so I've always had a passion for it and for lifestyle and less leaning on medications, but using medications when needed.
Interesting. I think you're probably the first person I've talked to who is in medicine. It sounds like before the standard American diet really took hold. What sort of differences did you notice in people kind of before and after it started to decline?
But in people or in the diet or in the,
In the diet, like the
oh,
what
well,
people ate just got more and more processed and stuff.
absolutely. Well, what happened was it's even more than just the diet. In the 50s, they started saying, don't take time to cook. Open these boxes and make these things. We've got these mixes. You shouldn't take time to cook. Rush, 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 rush. So they started this whole routine of not spending time on ourselves. And what could be more important than your health and what you eat? So that started. And then I remember when fast foods came in. I had one of the earliest McDonald's hamburgers.
Oh,
So,
really?
yep, is back in
Wow.
the 60s. So when fast food started coming in, oh my golly, that's crazy. And people really went, and
Yeah.
the foods that the fast food places were serving. And then they were becoming the dairy industry got in there and put excessive cheese. Like if you look at graphs of the cheese intake, we used to just have a nice modest intake, but then since the 60s, we eat so much more of it. It's out of balance. Is
Yeah.
out of balance. And then they cut cooking out of school. They used to teach cooking. So then this,
Seriously? I
yeah.
didn't even know that.
Yeah. And so now
Wow.
people come out of, they don't know how to cook and their parents aren't cooking. So people don't know how to cook as much anymore. A lot of people
Yeah.
don't.
Yeah.
So then sometimes when I was trying to help people eat, I was saying, well, yeah, no, it's not that hard to cook. But so there were those things going on, as well as then you were getting more and more food that had more sugar, more fat, more salt, so that the taste buds were just going nuts.
Yeah.
They were
They were
all
like creating food in the lab to be as addicting as possible.
exactly,
Yeah.
exactly. Yeah, it's amazing. Well, and think of the ads. There's this Britney Spears ad, all beautiful and everything, drinking a can of Coke. And then there's the "Aren't you hungry? Aren't you hungry?" ads for for potato chips, or "Bet you can't eat just one." They had all those things,
Wow. Yeah.
and convincing people they should eat all day, all the time, starting to snack and all that. So let's see, did that answer your question? So yeah, well, another example is back in the, I guess it was the 80s, early 90s, if a woman were starting to get towards 200 pounds, she was just like, oh, oh my God, I can't get over. Now it's really pretty common, and even
Mm.
300 pounds.
Yeah.
The weights have just gone crazy out of proportion. And the
Yeah, I think,
kids' weights are the one thing that finally set me off to start healthy eating adventure was I was in my office looking at a chart. There's this kid sitting there, and the chart said he weighed 150 pounds. That's more than I weigh. And it also said he was 10 years old.
wow.
Yeah. And then shortly after that, the statistic came out that this generation was going to have shorter lifespan than ours. So I'm going,
Yeah, that's going backwards. We were at least increasing the lifespan before.
exactly, Rachel. Yeah. So
Yeah.
those few things started, I got together some you know, leaders in the community, teachers. It's a small town. And we said, what can we do to make our town inspire people to live healthily?
Mm.
Not just me going, yep, 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 but make our
Yeah.
town, get the schools to do healthy lunches, but do biking and hiking. And we went to the restaurants and talked to them about healthy foods. And then then we started the healthy eating adventures. And
Oh,
that's all.
wow.
So.
That's super awesome. So you went like into the different areas of the community to kind of share with them how they can implement just like slight, small little changes in the system to help improve the health
Yeah,
of the people.
exactly. We built
Yeah.
a streamside trail. We started something to do the streamside trusting. So it was a whole concept of wellness that we tried to
Yeah.
share. Um, and it's all still going on, all that. And then the healthy eating adventure came out of, it was kind of interesting. Do you want to hear that story?
Yeah, absolutely.
Okay, it was kind of funny because there's Mercersburg's a little place, small town in Pennsylvania. We went there because we wanted the kids to have a place where, if they walk to school, walk back through town, they go, oh, that's the Dr. George's kids. People knew who each other were. and that was what we were after, and also just small town atmosphere. But there's a private school there, Mercersburg Academy. And as I was reading their alumni monthly, and it said that this fireman, Rip Esselstyn, have you heard that name, Esselstyn?
I haven't.
You might have, but not anyway. But Rip Esselstyn, and it said he's a triathlete, and he was working with his fellow firemen and noticing they were not healthy. They were eating all this fast food and everything, and so he decided he was going to teach him how to eat healthily, like he did for his triathlete stuff, and then he made huge differences in their weights, in their blood pressure, in their cholesterol. And so when I said, well, he went to Mercersburg, I'm going to call this guy that wrote a book, and the book was Big Splash. It's called Engine 2 Diet. And I said, I'm going to call him. I'm going to see if he'll come to Mercersburg and start a program with us. So I called him. I said, this is Dr. George. You don't know me, but would you come back to your school town? And he goes, yeah, right on. I'll be there. So he came, and we laid out the plan for a 28-day program, because that's what he did. But the interesting thing was, when he first came, we did it with a small group, and I had given everybody the book. Engine 2 Diet, and they came, and we were meeting with them, and one comes in, Debbie comes in, she says, Dr. George, did you notice that there is no meat in this diet? There's no eggs, there's no dairy. And I'm going, because I didn't realize that. I thought he was just teaching him plain old healthy food. Good. And I said, oh, well, if Texas firemen can take this on and do well, we can do it. So that's how we end up. And it turned out that his dad is Caldwell Eppleston, who had done research. He's a surgeon, a general surgeon, but he did vascular surgery, breast surgery, and he's an epidemiologist. And he thought, geez, I'm doing this surgery, but I want to know what's causing these problems. So he was looking at all the different countries, and noticed that in like Japan and in rural areas of China, where they didn't eat much meat and stuff, there was less breast cancer, less cardiovascular disease. And also there's places where they don't eat any animal products, and they have no cardiovascular disease. The Humari Indians, for example, there's places in Northern Africa, but they don't have any.
Interesting.
Yeah, it was interesting. So
Yeah.
Dr. Esselstyn was at Cleveland Clinic, and he came back. You have to tell me if I'm talking to you or if I'm talking to the.
No, you're good. You're
Okay.
good.
He came back to Cleveland Clinic, and he said, listen, let me have your patients, your cardiac patients there's nothing more you can do about that. You've done everything you can. So he got 26 patients signed up, and he and his wife, Ann Esselstyn, who is a registered dietitian or nutritionist, and they taught people how to eat whole foods, plant-based, leaving out processed food, and cooking all sorts of great dishes with plants. And they did remarkably well. And he actually had some patients, after 3 years, clogged arteries actually opened, and he had arteriograms of them. And that was the
Wow.
thing that made it, yeah. And he has a book, Prevent and Reverse Heart Disease, and you can see the, trying to think if there's one picture of that on my website. There might be. Well, there's one in the book. So if you
Okay.
get to read the book, yeah, the picture's in there in the
Yes.
description here. So yeah,
Yes.
and if you look at the work by the drug companies, they do not have any times when their drugs actually opened arteries by lowering cholesterol, because it's just so much more than. So it was remarkable. And then
Wow.
later he had 180 or close to 200 patients, and 180 of them were able to follow whole food plant-based. So not everybody does, but 100, so you can do it.
Yeah.
And the same remarkable results. So then he wrote his book, Prevent and Reverse Heart Disease. And
Yeah.
then, so that's what we were actually working with when we started our healthy eating adventure, was those results, and applying them and creating this 28-day program. And we would have them come in, and we do explain what whole foods plant-based is, but we also give them kind of the history. How did we get here? You know, what have the manufacturers done to you in the past few places? Because we figure if people know what got them stuck in this, they're going to go, I'm not doing it anymore. You know, I'm going to get out of it.
Yeah.
Yeah, exactly. And then we give them a little bit of the science that explains it sort of in people terms, so
Mm.
that, and then that makes you want to do it more if you know why it works. And plus the first night they came in for the initial introductory speaking, we served this fabulous whole food plant-based meal, a potluck, and the food's delicious, and everybody goes, you know, I didn't know food could taste that good. And then, and yeah, and then we teach them. They followed Caldwell's book, and they would take it on pretty much 100%, and they would cook all week, and then once a week we'd get together for a potluck. So we had 40 people the first one, and they'd come in, and there'd be 40 different dishes that they could taste and try, and they could go, well, you know, how'd you do this? How'd you make this? Where'd you find this? And they could taste it, and their palates were going ring, and they were sharing with each other and saying, "You can do it. I can do it." And you know, that was really powerful. I think that was one of the most powerful things. Yeah. And then,
Yeah.
yeah. And the amazing thing was, like, in a week's time of just really kind of sticking with it and leaving out the processed food, people said my salt craving went away. I'm not craving that fast, you know, fat food anymore. And they said my taste buds, I can taste foods again. I think that's really cool. And people said, yeah. And this was the amazing part. I'm sleeping better. My mood's better. My energy's better. And at the end of the month, when we did our graduation, people's cholesterol, of course, had come down. Their blood pressures had come down. Um, nobody's heart disease was gone by the end of a month. Though one time we did have a guy's congestive cardiomyopathy improve when
Oh, nice.
he'd been on medicine for more than a year, and they had finally told him that was that Johns Hopkins. They'd said, you know, get a rocking chair, sit on your porch, retire. And then his family convinced, and he could hardly walk a block, and you know, he
Mm.
wasn't getting better on all the medicines.
Yeah.
And his family convinced him, come on, go to this healthy eating adventure. This was a few years in, well, just about two. It's great. You'll do good. And within 3 weeks, he was back to walking the way he used to be able to. And in 3 months, he was back to swimming. And later that year, he got back to the senior Olympics. And that was after, you know, over a year of medicines doing nothing. And that,
Wow.
yeah. And I could tell you the whole
Yeah.
sense why that worked, but but I mean, it's not just, it's like the food actually made a difference in how the
Yeah,
blood
for sure.
worked. Yeah. Sorry, I'm talking.
No, 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 no worries. That's definitely super interesting to understand the background of the development of the healthy eating adventure, which is super cool. Um, I know you talk a lot about like the whole foods plant-based diet specifically. And you're not a big proponent of animal foods for sure, but I am curious if you, in your opinion, if there's a difference in like I know Mediterranean diet is one thing that is pushed a lot because you're eating like omega-3 fatty fish, and then most of the time conventional meats or red meats are kind of shunned a little bit. Have you noticed like for people who really want to have protein in, maybe they want help building muscle or um, maybe they're like athletes and they really need more protein to help them build muscle. Is there protein sources, in your opinion, that people can add in without causing any, negative symptoms, in your opinion?
Well, you know, look at gorillas. They don't eat meat. So there's lots of protein in plants, is what I'm saying. Like legumes are loaded with protein. So you don't have to have protein is, we correlate protein with meat, but it's not the only source of protein.
Yeah.
There's lots.
Yeah. You
And
can
they're,
definitely get protein from plant-based. I'm more so talking about the people who just want to eat meat.
oh, well, the ones who want to eat meat, are you saying, well, first you were asking about could you get enough for athletes? Athletes, yes. Some athletes, your recovery time's quicker. And there's this weightlifter, Pat Babarin, I mean, he lifts these huge weights, and football players, Rich Rolls, triathletes. So you actually you heal quicker afterwards when you're on plant-based. And we can talk about nitric oxide. Well, you know how some athletes eat beet juice? They take beets.
Yeah.
Okay, so that's because of the nitric oxide that comes from that particular food, as well as greens and beans. And nitric oxide is a blood vessel dilator. So that really helps them pump the blood. And that's why athletes take beet juice, but all the different things that we eat can do that too. Um, but in terms of can plant meat eaters be healthy? Meat eaters can be healthy, and lots of people live well along and as meat eaters. When you compare sort of the American Heart Association diet, which is just, take it easy, be careful with your meats, have fruits, vegetables. It doesn't emphasize whole foods as much as I'd like them to, and whole grains and everything. But when they compare that to a whole food plant-based, what you find is that both groups tend to lose some weight, but the plant-based ones actually, the measurements for inflammation is less, their cholesterol comes down more. So there's a greater impact from the whole food plant-based eating.
Yeah.
So while one works, the other one works a little more in those areas. Yeah. Did that
Okay.
answer?
How, yeah, how about like different forms of meats? Like, because I know conventional red meats that you typically buy in the store tend to be way more inflammatory than grass-fed and finished, organic, blah, blah, blah type of red meat. And then, of course, like conventionally raised chicken can have more of a negative effect on your health than the good organic, whatever
Mhm.
kind. Is that something that you have looked into in your practice, a little bit?
You mean in like doing a randomized controlled trial to see?
Well, like, have you looked into the research of that before? Because I know there are some people, if you try to talk to them about like plant-based eating, it does take some convincing, which I know you are sure of, but there's some people who are like, no, absolutely no way. So I'm curious
Yeah,
if you
then
ever make compromises for people, and like if you did, what would be your
I
recommendations?
think the ones you mentioned is
Okay.
you don't want and you don't want stuff that's been raised all grouped together where they're giving them a lot of antibiotics and stuff, because then
Yeah.
do you know that 2/3 of antibiotics are fed to animals they're raising?
Yeah, I
And
know antibiotics is a big issue in the
you end up with resistant
industry.
bacteria that you catch. Um, I was reading something about chicken, but yeah, they are inflammatory, but I think, right, what you're saying is, okay, so don't get the ones that are raised in crowded places, and let them be free range, including the chickens, and you'll have less trouble. And then the other thing is, well, they don't need to eat huge amounts, and they could eat, because um, what's missing, they're missing a lot of the minerals, anti-inflammatory capabilities that plants have.
Yeah.
And,
I know
and
people are wildly under eating plants nowadays. I mean, colon cancer, for example, is crazy high in young people because they're not getting enough plants. So while
right,
I like to recommend good sources of meat for sure, sometimes I just want to talk more about plants because of how much people are under eating and underestimating the power of plants.
you are so right. That is
Yeah.
exactly. It's you're it's not that you're depriving yourself of things. You're putting in stuff that is really going to help. Plus, it's great. I mean, it's really
Yeah. Oh my gosh.
delicious.
Vegetables cooked the right way. literally tastes like candy to me. Like I love baking vegetables with some like
Yeah.
avocado oil and herbs. It's the best thing ever, honestly. I'm a little weird about it. I don't know, but
Because your taste buds
yeah.
are awake. You're not eating a lot of processed food and you're not all suckered into salt and fat and everything. But yeah, so the thing is, I think is if their goal is to get more protein, have them get more of the protein from plants, but they can still put their, put a little meat in their chili or whatever, but eat more legumes because there's other things in the legumes. Like, well, if they want to be athletes, get the nitric oxide, like from the legumes and the greens and the,
And the
so
beets.
I think that's what you're doing, it sounds like, is really emphasize getting in the things we're missing.
Yeah.
And then
Oh,
be
100%.
yeah, and then being careful of what they're choosing. Like, don't be going to McDonald's. I mean, I don't mean to be nasty to them, but don't be.
No, no, no. You could talk about those things as much as you want on my podcast. Don't worry.
But yeah, you just so that's that. And the other thing is the colon cancer probably is increased in persons who choose meat. Prostate is increased in persons who choose dairy. So there are, I mean, there's just some.
Yeah.
We're the only animal, we're the only animal species that eats drinks some other mother's milk.
Yeah. I personally don't, I haven't eaten dairy in like 6 years because I get an inflammatory response from dairy. And there's a lot of like carnivore, animal-based people on social media who are like talking about how they cook everything with butter, eat raw milk, eat, only red meat and everything. And I'm like, I literally get acne, joint pain from eating, and I don't think I should be getting issues from that. I'm not sure why I have such an inflammatory
Yes, hey,
response to
no,
it.
that is totally right. That does cause those things. I didn't mean to interrupt, but you're like
No, no,
hitting
no,
the
your worries. No worries, sorry.
thing. We have seen, I can pretty much say to a person, sometimes I'm tempted to in the airport because there's more acne now than when I was younger. And I'm tempted to say to them, look, if you give up the dairy, I bet your face will clear if the
Yeah.
dairy is excessive fat.
No, like,
Because, and
go
I
ahead.
had a girl in our program once, she goes, Dr. George, is this going to make my skin clear up? I said, we usually see that. I bet you it will. And it sure enough did. Yeah. Yeah.
Yeah. Yeah, dairy has been something, and I don't think everyone has the same response to dairy. Because some people can eat all the dairy they want and they don't specifically have acne. It might show up in different ways, of course, but I don't know. For me, I've just never really seen a lot of benefits from eating dairy. So I haven't eaten it in, I think, like 5 years. And my skin, I used to have a lot of acne, skin issues.
Yeah. That's
I
so
even
cool.
had like, I don't even know what it was, but I would get rashes on my face, on my body, hives and stuff. And ever since I changed my diet, I haven't had like any skin issues aside from a random pimple here and there, of course. But
But that's not, I think it's getting more common because of people's increase in cheese and everything. And I had this one patient of mine for years, and she had seborrheic dermatitis all up through here.
what is
And
that? I don't know if I've heard of that
it's an
one.
inflammatory thing. It looks a lot like eczema,
Okay, yeah.
really real flaky and red.
Ooh.
And as
Oh,
you
that
know,
sounds so uncomfortable.
it was, and I kept saying, I said, listen, I know if you give up the cheese, that I bet you that's going to go away. And she go, oh, I can't. I'm from Wisconsin. I can't give up cheese. And then one year she came in and went, I gave up the
Oh,
cheese, and it was gone. It was clear. I asked her if I could
yeah.
talk about her in the book, so it's okay.
Okay, yeah. That's super exciting though. Yeah.
And I also had a farmer's wife that came in for her regular checkup, and she goes, I gave up the dairy. My asthma's gone.
Wow.
So that's kind of the same kind of inflammatory reactions you're having, only it's in the lungs. And that's pretty common too. It
Yeah.
does. So I right on with discouraging. And I wonder the people that aren't bothered by it, are they not bothered by it, or they don't realize that the joint pains they're getting, or they're low energy, they're not sleeping,
Yeah.
their mood, or
See, that's the thing. People tend to be in denial a little bit. They're like, oh, I don't think it's caused by this because I like eating it. So, who knows? Who knows really? But yeah, for me personally, I've never been able to, or ever since I noticed it was causing my Acne specifically for me, I was like, yeah, I just can't have dairy anymore. And I remember one time I went to a restaurant and they cooked with butter, and I didn't know that in the beginning, but I started noticing it because I literally felt like acne was starting to pop out of my face
Oh my golly, yeah, you have
while
an
I was eating. Like, I don't think it works that fast. That would be really weird. But I
no,
was literally like, this doesn't feel right. I think there's butter in here. It was the strangest thing ever.
if you get a bee sting, it's instantaneous, this little
Yeah.
teeny bit. And it's like that kind of thing with the dairy protein for some
Can it
people.
work that quickly?
Well, a bee sting does.
Yeah.
But yeah, no, I think it could.
Wow, yeah.
Yeah, I think people have, and for some people, it's, worse than others. But you're right, people have to make their own choices, and you just share with them how you're doing, and then, and, you know, just lay it out.
Yeah.
Yeah.
Yeah, absolutely. I know for me, I mean, we talked about this before the show. I still do recommend animal proteins, but I try to encourage people to get good quality sources because if you get farm raised fish, that's super high in omega 6s and has been shown to increase inflammation versus omega 3 fatty fish. I live in Alaska,
Okay.
so we get
Oh,
our own fish,
oh,
which is
great.
like the best you could possibly get, and that's really good for reducing inflammation in the body compared to the farm raised stuff. And then the same thing with a conventional like chicken or eggs versus the healthier kind, while you may focus on like the plant-based. I do think that little swaps like that for people who still want to include, proteins and stuff can still be really valuable. But the biggest thing that I think we need to start pushing, like the medical health community in whole, is like eat more vegetables for sure because people are widely under eating that. So I'd love to get into kind of like what impacts did you see or do you see in people's health from not eating enough vegetables and plant-based foods in general.
So they should eat more fruits, vegetables, and legumes. Well,
Yes.
one big thing, people go on there, on the whole food plant-based, and they come and they goes, I'm not constipated anymore. My bowels are moving. Like, yeah, it's like clockwork. It's like I have an alarm. So, I mean, just simple things in their lives that are improving because they're starting to put enough fiber in. And
Mm.
fiber, really, really important. And you don't get fiber from animal. So if you're not getting enough fiber, then your guts aren't going to work right. Um, you know, the fi the fiber was, you said, what kinds of things have I seen in people who aren't getting enough plants? Yeah. Well,
Like conditions, symptoms, stuff like that.
well, so people need fiber because the fiber feeds your microbiome. And your microbiome is really, really important, but you need a healthy microbiome. And they make the microbiome make a molecule called butyrate. And butyrate is actually sort of the energy molecule for your intestinal cells. It what helps them keep healthy. And also butyrate can get rid of some of the colon cancer type things. And it also stimulates the normal white cells from growing in the bowel. So, well, for one thing, during COVID, whole food plant-based eaters had less severe disease. So there's maybe less immune support. Um, but then if you are don't have enough fiber, then your gut's not going to be healthy, and you're going to have stuff more like leaky gut
Yes,
or
one permeability, yeah.
yeah, inflammatory bowel, and then or you're going to if you don't have enough foods, you're going to be growing more of a kind of unhealthy microbiome. I mean the
Kind of
bad,
leading to SIBO type stuff.
yeah, and they make things like one thing those bad bacteria do, they take carnitine and they make it into a molecule called TMA. And then,
Mm.
yeah, TMA is absorbed and becomes TMAO, which is an inflammatory molecule. It's a major cause of your blood vessel inflammation. And that's your vascular disease.
And that happens with not enough fiber.
Yeah, because when you're not getting enough fruits and vegetables. Well, it's the fruits and vegetables that are making the fiber. Then you
Yeah.
grow, and then, well, and then the other kind of the standard Americana diet just sort of encourages these other bacteria that just are not very nice. Um, and then well, another thing that you're heating your healthy, your fruits and your vegetables, because that's where the fiber is, makes your microbiome. So you have a healthier gut wall. Well, you've heard, Ozempic.
Yes.
So it's giving this molecule, it's a gliptin agonist. It makes that. Well, guess where that comes from? That molecule, gliptin, is made by cells in the gut wall. Um, and those cells don't function well when they're inflamed and when they don't have enough of the butyrate. So
Mm.
you don't have to take Ozempic. You just have to put the right
Get
food.
enough fiber. Yeah.
So you put all your
Yeah.
fruits, vegetables, legumes in,
Interesting.
and whole
Yeah.
grains. We haven't said whole grains much. And I don't, what I would really like to see, and I haven't seen it yet, is how much meat does it take to shift your healthy microbiome to not as healthy? So I don't, that would be really hard to find out,
Yeah,
but
I feel like that research would be really complicated, but that would be really interesting to
that
know
would be, it's
because it's
like,
like don't go above like a certain threshold of meat to keep it good.
yeah,
But
but so that's those are just a few examples. Well,
yeah.
here's another nasty thing those bad bacteria do. They break down tryptophan. They use it for their own good. But you need tryptophan to make your serotonin. And the healthy bacteria actually help get tryptophan from the help produce tryptophan and get it absorbed so it can go to your brain and be turned into serotonin. So then
Hmm.
your mood is better, your energy is better, your sleep is better. And the gut wall helps make serotonin for your peripheral nervous system too. And there's just
Yeah.
the stuff that
Yeah, a lot of stuff for
done.
sure. About like 70% of serotonin is created in the gut, right?
Yep. Yeah.
Yeah.
But not when you have the unhealthy.
Yeah, well, it should be
I
created in your
mean,
gut.
yeah. But that serotonin doesn't go into the brain. That's for your peripheral nervous system.
Okay.
You had to use histamine to get across the gut, the brain barrier, the blood-brain barrier. And
Oh,
that
okay.
turns into
So
serotonin
like is that like histamine connected to the serotonin to get into the
in the
brain,
same
or what do
way.
you mean?
Tryptophan. Tryptophan has to, Tryptophan can make it across
Oh,
the
okay.
brain barrier, and then it turns into serotonin, and that's a neurotransmitter within the brain.
Oh, so it's the tryptophan created in the gut that turns into serotonin in your brain?
Hmm.
Interesting. Okay, I didn't know that. That's
Yeah,
cool.
yeah, it is cool. Um, well, another thing is acetylcholine. And I don't know how much they commit, but acetylcholine is another neurotransmitter that's in the brain as well as periphery. So if the gut bacteria that you have are up there um, eating your carnitine, they also eat your choline. They break it down for their own good. Then it's not going to get to the place where the acetylcholine is made. So
Hmm.
you maybe just aren't getting quite enough of those different neurotransmitters.
Hmm.
I know you, I've just seen such changes in people's moods. Like one guy, he said, Dr. Liz, do you think that this has gotten rid of my anxiety? I have had anxiety all my life and I'm not anxious anymore. And you could sort of see how, well, if you weren't getting quite enough serotonin, enough acetylcholine in your brains, or if you've got too much inflammation that's going blah, 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 in your brain, you know. And another woman a week into it one time got up and said, I'm not depressed anymore. Is anybody else's mood improved? And they also notice that this is that their energy is stronger. This is more back to the athlete's meter. We had people who said, I never was much of an athlete, but I just found that like, well, I went and did a 5 miler this summer because they just felt like energized and like they could go. And maybe it was because they
Yeah.
didn't have the things that were making them sluggish, but they also had the things. Yeah.
Yeah. That's interesting. Um, I had a question.
Yeah, I'm sorry.
No worries. No, I had a question from what you just said, but I forgot what it was. So, oh yeah, that was the question. So, by helping people eat, like focus on whole foods, plant-based diet, they're able to see these positive improvements. How many like servings would you say people are typically getting of like vegetables and fruits and stuff like that per day where you've seen the best benefits, if that
Oh,
question
I
makes sense?
haven't, I can't say where I've quantified it that way, but people that have, say, like 7, 8, 9, you just, but if that's what you're eating during the day, your fruits and your vegetables, and like you have your granola and you put fruit on it, and then at lunchtime you have I try to have a big salad twice a day at least, and then other greens and stuff like that. And then you have your other vegetables, and you should have some grains every day. So it's in my granola and another grain, and then just try to have legumes regularly. And then
Are
your fruit
there,
vegetables.
sorry, I didn't mean to cut you off.
No, you're good.
Are there any grains that you tell people to prioritize a little bit more than others?
There aren't, but I bet there are some that have more exciting stuff in them.
Yeah.
But brown rice, farro, basmati rice, all of them. Do you have some that you love?
Yeah, I definitely love rice and stuff like that. I'm more so have a question on like gluten, if that's something that you've kind of paid attention to a little bit in your practice.
Well, some people, so the healthy eating adventure isn't part of my practice, but of course my patients benefited from it. But actually, it was really amazing. They don't even have to take the healthy eating adventure. This is off track, but one summer I saw this woman's cholesterol and I said, "Oh, your cholesterol is so high. Here, why don't you use Dr. Esselstyn's book?" The next year, she comes in, her cholesterol's come way down and her LDL's way down. I said, "What'd you do?" She goes, "You said to read this book," and I did. And she followed it all on her own. So it was just
That's like
amazing.
a dream client.
Yeah. Some people do. Well, you know what? I think you probably find that though. If you're consistent and you're giving them this and sharing it with them and really relating to them, they're going to hear it. And you just keep in.
Yeah.
What track was I on when, oh, gluten? Yeah. I mean, if
Yeah.
people are gluten intolerant, then they don't want to choose the ones that have gluten. I mean, sometimes people have been labeled gluten intolerant when they're not, but I mean,
Mm,
certainly, some people are really uncomfortable with it, and then you just have to stay.
yeah. Have you like read or experienced about like how gluten can influence leaky gut or intestinal permeability for those who have sort of inflammation in their gut?
Well, I think the gluten would definitely aggravate that.
Yeah.
Yeah, I mean,
Yeah.
I could probably produce it. I imagine it causes inflammation. So then your gut, yeah.
Yeah, because I know, because that's a really big thing in my practice since I help people with gut issues a lot. Gluten tends to be an aggravator of gut issues, and of course, I'll try to see if they're even sensitive to gluten in the first place. If they have like absolutely no symptoms when eating gluten, we'll assess other symptoms, but most of the time I see gluten as a big temporary problem for people who have like severe gut issues, especially intestinal permeability symptoms, because it can exacerbate that inflammation and start tearing at the gut lining. And until you heal that gut and reduce that inflammation, I've seen that
So you
gluten
have
is
to,
one thing that's tends to be a little bit positive to bring out temporarily at least.
yeah. Have you seen the work by Bruce Bolshevik on the microbiome? It's really
I don't think so.
That's really good. He's a gastroenterologist and if you can get your microbiome healthy, that leaky gut stuff will go away. And in fact, inflammatory bowel disease will go away. And that's what whole food plant-based eating can do. And I don't know how much meat. I would think you don't want to put dairy in there, and I don't know how much meat you could still put in. But that definitely, and it's fun. You'll enjoy his work. So maybe take a look at it. That they're a healthy gut microbiome. Your microbiome does more than your body does almost, because it's taking care of inflammation, it's helping your brain, it's protecting your heart. It's just kind of really amazing.
Very important. Yeah.
It's really fabulous. Yeah.
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 Yeah. Interesting. Awesome. Let me see if I have there was a couple other kind of points that I wanted to dig into. Let me see where we're at. Mm. Oh yeah, I wanted to talk a little bit deeper on the podcast today about the nutrition gap in medicine
Oh yeah.
because I've heard a lot of frustrating advice that doctors have given to people. Like, if you take a multivitamin, you don't have to care about your nutrition at all. And that's very, very dangerous for people because nutrition, honestly, is one of the biggest aspects in people's health because of its impact on your microbiome. As you just said, your microbiome is a huge part in your health, regulating your inflammation, your heart health, literally everything. Um, Even your mental health too, as you were talking about before. So, I guess like why aren't doctors taught about nutrition and what's your take on why this gap even exists in traditional medicine education?
I am flummoxed by it. I don't know what that is. And we are working with my university, Brown University, but others, and some are starting to catch on and starting to teach the students about nutrition. I don't know what that is about the personality that has them not. I mean, the literature is very clear. All they have to do is read it. And I don't know, maybe they don't want to give up, junk food. So I have found that the doctors that didn't know of it, like I used to, when I was living in Pennsylvania and practicing still, I would present at the doctors' CME programs, and they really started to catch on and be interested. Um, but I totally cannot fathom. Well, some of it is, and this is really frustrating. This usually used to tick me off so bad. They wanted you to treat the numbers and all the guidelines, and they wanted you to add this pill and that pill and this pill and that pill. And some of it is just all about pharmaceuticals, about insurance companies pushing this, pushing that, and just not getting the right. And besides, if people aren't healthy, the the doctors and hospitals can make more.
Yeah.
But I really, if you figure that one out, let me know. But I have found that if you can start to talk to them, they can get interested and take it on. But we're certainly
Yeah,
working on it. Yeah.
yeah, I've had conversations with quite a few doctors who transitioned into the I guess like functional holistic type
Life,
space, whatever you want to call it, not like
lifestyle
the medical
medicine is
system.
new. Lifestyle
Huh?
medicine. Lifestyle medicine is a new training program. So maybe that's a bright place
Okay.
there. Yeah.
Yes.
Yeah.
Whatever word you want to put on it.
Oh, no,
And
there's actually sort of a degree or a actual program. So it fits right in with what you're saying, but there's actually one labeled that now. Like you can be
yeah, yeah. Like there's like functional medicine doctor, I guess. You said
lifestyle medicine.
lifestyle medicine. I love that
That
actually.
actual training now. Yeah.
Yeah, wait, like a doctorate training or
You get it after, it's like when you get your trained to be so when you're in residency, you go into a family physician residency or you go into a GI residency or whatever.
yeah,
And
get your
so
specialty.
go into, it's like a specialty. Yeah. So they,
Interesting. Yeah, that's super cool. Well, that's definitely a good addition for
as
sure. But
it is for
um yeah, I have no idea. Was I asking a question? I don't know if
uh,
I was asking a question, but
no,
pharmaceuticals I feel like are a huge like the pharmaceutical companies I feel like is one of the biggest drivers of why nutrition was taken out of the medical system so much because I feel like people used to have an innate understanding of what they needed to feed their body before there was a ton of highly processed foods. They were able to fuel their body with whole foods, even if different ethnicities and countries, it was made up of different types of foods, they were still eating whole foods and what their body specifically needed. And people have just become so disconnected because of what they've been pushing for the past 75 plus years, I think, at least. Um, so
So,
like
yeah.
what are some consequences, I guess, do you see when nutrition is left out of the healing plan? And I guess
Well,
you could answer that question.
I mean, there is so much more, it's the cause of everything. I mean, there's so much more diabetes, hypertension than there ever was. The people struggle with their weight. The the children even have diabetes now. They even have fatty liver in kids. And a lot of adults have
Really?
fatty. Yeah, kids
Yeah,
have
I
fatty
know that's
liver.
rising a lot in adults, but that's scary that it's in
Yeah, and you
kids.
think, but because it's they're not eating what they need to eat, and they're eating a lot of stuff that they shouldn't be eating. And then so when these kids get diabetes, then the drug company says, "Oh, good, give them this medicine," or da, 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 da. They just go right into treating it instead of preventing it. And
Yeah.
they're not treating the
They're
cause.
not actually like treating the root cause of the issue. They're just trying to find whatever medication that they can get. I have a
Doesn't
question. This is totally kind of a little bit random based on what we're talking about, but do doctors get a sort of like commission type pay for medications that they prescribe? This has always been a question on my mind.
Yeah, no, I don't think they get a commission from it. And one of the reasons I didn't continue further into nursing, I mean, I was old enough to retire when I retired, but I just didn't like the whole system anymore.
Hmm.
I didn't, I didn't like the insurance system. I didn't like the way thing, all this. They tried to tell me I could only have 15 minutes for a visit. And I said, no, I'm sorry, I'm not going to only see patients for 15 minutes. Make my appointments 30 minutes. And if you want to pay me less, so be it. But I didn't, I just wasn't gonna. And then I finally just, and then now doing healthy eating adventures, I can treat more people and reverse their diabetes and their hypertension much quicker, much,
Yeah,
much, and their immune disorders. I'm just amazed. Can I tell you another story?
absolutely. Yeah.
So the one woman came in, and a week after she was there, she told the story. She said, a month ago, I was diagnosed with ankylosing spondylitis. She said, I had been having back pains and joint pains for years, for like 15, 20 years, and nobody knew what it was. And they finally diagnosed ankylosing spondylitis, and they wanted to put me on medication. But fortunately, her doctor, I'm going to say his name because he's Dr. Gaudios, we had worked together and he'd been to the program. He said, no, before you do that, go to Healthy Eating Adventure. And within 2 weeks, a week or 2 weeks, her symptoms were gone. Her symptoms of
Wow.
pain and back were gone just from going whole foods plant-based. So
Wow.
15 years of, because it was all inflammatory. So it was causing all those problems. And then 2 years ago, when maybe it was three now, time flies. We did our, we went, we went, we
Not when you're
started to
writing a book, though, huh?
do by video. What did you say?
I said not when you're writing a book, though, huh?
Yeah. We were doing it by
Sorry.
video, and another person had the same experience with their ankylosing spondylitis going away after it had been there for years. And that's what the
Wow.
autoimmune is. And rheumatoid arthritis can, psoriatic arthritis. So I forget what got me on this rampage, but but yeah, it's just kind of ridiculous that.
Yeah, because I know a lot of people. I knew someone when I was in college, I had a classmate who was maybe like 20, maybe 21, somewhere around there. She had arthritis in her hands already. I was
um,
like, you're like super young. How do you have arthritis in your hands already? And then I started going through a bunch of health issues. I had like chronic nerve pain down my arms, down my legs, joint pain in like every single joint. I didn't go to the doctor because I had already lost trust in the medical system.
yeah.
But by reducing inflammation, regulating my nervous system, improving my nutrition and stuff like that, I was able to help my symptoms completely disappear. Like, I don't have
That's,
any nerve pain down my legs or my arms anymore. I didn't need to get a certain diagnosis, but by reducing inflammation, diagnosis. Why did I say diagnosis? Whatever.
it's fine.
But
Yeah, and absolutely, that's the what did you have like jumpy arms and legs or just painful?
do you
Did you
mean
have
like it would shake a little bit?
no, and at night they'd keep you awake and they'd be uncomfortable and you'd be moving them around
Oh
and
yeah,
everything.
100%. It would be like hard. I don't know if maybe like jumpy is the right word, but it was
That's
really
just
uncomfortable and I would have like buzzing down my arms and my legs and then sometimes if I moved wrong it would like shoot nerve pain type of thing.
and that's so you got rid of the milk and
Yeah.
other inflammatory things. So it just makes sense. I've had three different people get rid of restless legs, which sounds very similar to what you had. Yeah. And
Yeah.
when they went whole foods plant-based. So I'm not sure which part of it is, but that's amazing. It's so wonderful that you discovered that. Got
Yeah.
rid of, when maybe it's some of the junk food also that's being
Yeah.
like, because you can't put in stuff that's not food. It shouldn't even be
Yeah.
called junk food. It should just be called junk because it's not
Yes.
food.
It's not real.
It's not food. Yeah.
Yeah. Yeah,
Great.
absolutely. So for me, honestly though, like I wasn't even eating a lot of junk food before then. And I don't even know if I got rid of dairy like I don't think I got rid of dairy through that specific journey. I'd gotten rid of it before. For me, a lot of it was actually stress. I put so much stress on my body because I had an eating disorder. I was under eating. I was overtraining about like 14 times per week, and then I was working in
Oh, wow.
person as a personal trainer, building a business in college over full time. So the amount of stress for me, that was like the biggest issue. And then just like not enough food, not enough rest, didn't sleep. There was a lot of different compounding things that was also leading to inflammation in my body. But I also learned how to fuel my body properly because I didn't necessarily switch from junk to whole. I learned how to eat the right whole foods, balancing my blood sugar and stuff like that. So eating enough. But
This is a little off topic, but it was in one of your um little discussions you have about insulin resistance. You mentioned that. The
yeah.
You know that they have found that insulin resistance is actually caused by fatty deposition in the muscle. So there's new studies out. So the problem is saturated fat. So these foods that are high in saturated fat produce insulin resistance because the fat gets deposited in the muscle, and then the insulin can't attach to its receptor on this muscle cell to bring the glucose in. So the muscles can't take up the glucose. So you have resistance to the insulin. So yes, the high glucose is a problem. It's because it can't get into the cells. And then the other,
Interesting.
yeah, it's fascinating. You should check it out. And the other problem is so that's your insulin resistance. The other problem is then the foods, the processed foods, the sugar in them is just quickly broken down and taken in. So you get these boosts in insulin. And then also your abnormal gut bacteria aren't making the gliptin well, so you're getting that. So it's like this whole big thing.
Hmm. That's something that's not talked about enough. So you said there's new research coming out and showing fat
Yeah,
de
insulin resistance. And the
deposition.
fat
That's not the
deficit
right word.
is mu-
Deposition.
um,
What is
it's
the word?
it's liposis in the muscles. Yeah.
Okay, yeah. That's
And
super interesting.
you can find that. Just look, Google, um, study on insulin resistance caused by fat or something like that.
Okay. Yeah.
Um,
Yeah, for me, I know the biggest thing that I look at with insulin resistance is number one, like metabolic inflexibility. A lot of people are eating food constantly, snacking a lot in between meals type of stuff, and their eating window is like super, super wide. I'm not a proponent of intermittent fasting personally, but I do think that we need the eating window to be shortened, especially in the evening, which also helps improve sleep. But also, I'd love to actually get your thoughts on this as well, kind of just kind of going back and forth with different opinions. For me, regulating my blood sugar is a really huge thing. So if I'm going to eat carbohydrates, I try to pair it with like a protein, fiber, or fat just to help reduce that initial blood sugar spike and then later on drop. And then of course, when I'm eating meals, I try to eat in the order of fiber, protein, fats, and then carbohydrates. For you personally, is that something that you try to practice within your um I keep saying the word practice. What do you want me to in your
But
space? Is that something that you personally practice though?
eating whole foods, plant-based, that's what you're producing. You're producing a situation where you don't have simple carbohydrates. They're complex carbohydrates because they're packaged,
With
with the
fiber.
fiber and with the rest. So you're getting those together. You're not getting the overdose of fat. You're getting, just nice amount of fat, and it's a healthier fat that you get from, say, from a smaller portion of nuts, or everything has a tiny bit of some fats in
Avocados.
them. Yeah, and avocados, you do need some of your foods that have the omega-3s in them, your short chain fatty acids, and that's flax seeds and chia seeds are some of them. And that's off what you were saying. So I think when you eat whole foods plant-based, or predominantly whole foods, and you're plant-based and you're leaving out some of the things you're saying, then you're getting that combination where
Automatically.
that you don't get those really nasty sugar spikes, and your body has time to handle it and process it. Plus, it can process it because it's got the hormones lined up right, and they can get into the cells and everything. So
Yeah,
yeah.
absolutely.
So
So
what?
does that mean that you probably recommend like brown rice over white rice? And if people ever eat white rice, really make sure they like add some like fat to it, fiber with it when they eat it to help
Well,
reduce
I
that
would
blood sugar
say
spike.
it's already loose. It's already running loose. But yeah, I would say, but when you take off the rest of the green, you're also whacking out a bunch of nutrients.
Nutrients, yeah.
So it's like taking out off all of the outside leaves on the lettuce. You're taking out the ones that are the healthiest. Or it's like peeling your potatoes. Potato peels have a lot of nutrients in them, plus the fibers.
That's like not eating the peels of the kiwis. Everyone thinks I'm crazy.
Yeah, are people eating kiwi peels? Because I can't say that I've taken up that yet. Is that a thing?
Yes. Oh my gosh, that's where the fiber and the nutrients are.
It's true.
I just cut off the end, I slice it. I don't personally like just eating it, but I'll like slice it and put it in whatever I'm eating. Or if I
That
want
would
to eat just
certainly
a
be
kiwi, I'll
true.
slice it.
I
But
mean, that would be where they're.
yeah. And then
Yeah.
how about with potatoes? Because potatoes, I'm pretty sure do have a relative, I think their glycemic index is like moderate, correct?
Well, it depends on
Can't
what kind of
remember.
seed. So those big white potatoes, those are, they are,
Russet?
well, I don't know what their name is, but they are hybrid. The ones
Hmm.
that McDonald's went down to Bolivia and got the farmers to start making, and I know this because I was there, growing those potatoes instead of the nice little red and purple ones. So those, yeah, they don't have the fiber of the healthy potatoes. They don't have the fiber. They don't have the nutrients. So the big white potatoes, they're just like almost like eating processed food, basically. But there's lots
Hmm.
of potatoes that the skins have all sorts of nutrients, and the body of the potato has lots of wonderful fiber, and your yams. So
Is
it
it what? Because I know there's like smaller white potatoes. Like when I was growing up, we had a garden and the potatoes that we grew were like white, but they were like smaller like this.
it's
Is
not
it
that
just like the big russet potato? I think it's called russet potatoes, the ones that are like this big.
I don't know what if they're all called russet, or if that is the name. I'll have to research if that's the one that McDonald's turned into. But yeah, no, the little ones aren't. That's not the nature of them.
Okay.
It's just the big ones.
Okay. Okay, interesting. Yeah, that's definitely it's so interesting when you're kind of digging into this stuff because you kind of realize that it's not so much about like what was this? Where was I going with this? There's like tiny little swaps that you can make in your nutrition that make a huge difference, like eating potatoes that are actually full of the fiber and the nutrients versus eating those big russet potatoes, I think is the name. I'm just gonna go with it for
You can go.
now. If I'm wrong, people can correct me.
That's all right.
Um, that lack that stuff and can spike your blood sugar a lot more. And by getting those with higher fiber, higher nutrients, you're able to help improve your insulin sensitivity, your nutrient profile, your gut, literally everything. And it doesn't have to be these super complicated rules that people have to follow. Just try to get,
Oh,
yeah,
that's what's
just get
cool.
whole foods that
Yeah,
are
you
as in their like
fruit,
natural form as you
vegetables,
can.
legumes, whole grains. Easy. And you know, it's so easy. Last night, it's so easy to cook. Last night, I was at my grandkids' soccer practice and I came home at 7. I hadn't planned a meal. I was early in the day going to make a lentil loaf, but I didn't. So I got out carrots, celery, onions, chopped them up, threw them on the pan. I don't use oil, but I use a little bit of the vegetable broth that I make from, I can tell you this and that later, the old vegetable pieces. You anyway, and simmered them along. That's mirepoix. Simmered them along, then added the mushrooms, and then added a whole bunch of vegetable broth, and then added the lentils. Cooked it for 30 minutes, added some cumin, some paprika, some garlic. Boom.
Mm,
Add it. I had
that
a,
sounds delicious.
it
It
was
sounds like an
delicious.
Indian
It was,
type
it was
type
30
style meal.
minutes. Easy. And if you have a well-stocked pantry, which, by the way, there's a chapter in my book called, there's a
Yes.
section.
Yeah.
It's so funny. The people that are coaching you on how to sell your book, they say, be sure you mention the name of your book a few times while you're being interviewed. It is
Yeah, well
not.
that's helpful, repetition helps it get into people's head.
Yeah.
Yeah.
Okay. Healthy eating adventure, the science, the success stories, the recipes of plant-based eating, but it's not my style.
You're
But
good. No, I completely get
you
it.
know what? It is there, and then on the website, the Healthy Eating Venture, I do so much where you can get home at 6 and in a half hour have a meal made if you just have your, you just have a well-stocked pantry. And
Yeah.
um, and I didn't
Is the
like to cook before I went plant-based. I didn't like
You
it.
didn't like what?
I didn't like to cook before I went
Oh
plant-based.
yeah.
I just didn't. One one night when my husband was away, I was cooking. I made chicken for dinner. And the next morning I thought, wow, I can still smell that chicken. And I went in and I had left the chicken in the oven cooking all night long.
Was it like black? Oh my gosh.
That's because I don't have the mindset to, I don't know, watch that kind of stuff.
Yeah. Oh my gosh, that's funny. That's hilarious. I did have a question from what you said before. You said that you cooked vegetables in the pan, but you didn't use oil. Do you typically not use oil to cook
Yeah,
with?
yeah, there is some research that shows that oil decreases your um, vasodilation. A glob of oil decreases your ability to dilate the blood vessels to dilate quickly.
Any like specific oil, like seed oils, or what do you think about like avocado oils?
Both, including all the oils, including olive oil. They did it. There is a study on it that shows the change in the blood vessel's ability to dilate after a dose of that. I think if you
Interesting.
eat it in an avocado, trouble with avocado, it's got a lot, but I think if you eat it within a food, it's different than if you take a spoonful of it.
Interesting. I
And
know.
yeah, yeah.
'Cause I know for me, I only cook with avocado oil because it has a higher smoke point. I know extra virgin, like olive oil, extra virgin olive oil, it doesn't, and it changes the molecular structure of the oil that can lead to oxidative stress on the body. And then, well, before I say anything, what are your thoughts on like using seed oils to cook with or eat
Well,
in general?
it's really feeling, I mean, so they're not whole, but you're taking a food that's got everything in it, and then you're squeezing out the oil and you're leaving the rest. So you're just opening a can of worms, basically.
Yeah.
And you're losing out on a lot. You're losing out on the fiber and all the nutrients that are in it. And I actually like food. Like I'll go into a Mexican restaurant and I'll say, and when you cook my vegetables, do you think you could cook them in a little bit of, steam them in a little bit of wine instead of oil? And I just think they're so nice then. They're still like the vegetable. You're not getting this oil coated thing.
Hmm.
Um, and some people still use oil. Caldwell Esselstyn in his work and his research found that the oils were a problem, and there's others that show that. So I'm just not. I'm really I like it when we use the whole plant
Yeah.
because when we digest it, it helps the digestion process, and you absorb the different things, like we were saying with the complex carbohydrates. The same with the seeds, rather than having the oil, you're getting the everything with it and all that.
Yeah. Yeah, I wanted to ask before I said anything personally because I have found that there's a lot of research, conflicting research, but I have seen that seed oils can lead to inflammation in the body because they tend to have a pretty high omega-6 profile. And if that leads to your omega-6 or your omega-3s becoming out of balance, that's been very clearly shown to cause inflammation in the body. I'll see some like registered dietitians online being like, no, absolutely, like seed oils do not cause inflammation in the body, like blah, blah, blah. There have been instances, or research has shown that it reduces the instance of cardiovascular disease. But then I decided to go down a really long rabbit hole because if I'm going to say something, I want to understand like why I'm saying it and back myself up with it.
Right.
And I was like, okay, so what causes inflammation in the body? High omega-6 to high omega 3 ratio. And I discovered that even just like a few tablespoons of seed oils per day can lead to the ratio. It should be 4 to 1 to 20 to 1, which is insane.
And it's and you don't need the oil. You can
Yeah.
just get it in the plants, you
Yeah.
know, and
Yeah. I still cook with, I only cook with avocado oil just because I cook for my boyfriend who's trying to gain weight. And he needs to get like as many
have him
calories as
eat
he
some
can.
a
But
few nuts. Have him put some walnuts on his salad and things like that.
it's easy. He has a relatively low appetite, so I have to hide it.
Yeah, yeah.
But
There are these special situations. You could always
yeah,
slice avocado onto a salad.
yeah. He eats a lot of avocados.
That's there you
But
go.
yeah, growing boys, what can you do when they're trying to gain weight with high metabolisms? But so sometimes you have to make little compromises, and I do think that
Yes,
from the
absolutely.
research that I've seen, I do think that avocado oil seems to be a safer option. Of course, the science of nutrition is still developing, of course, but as of now, that seems to be the best choice. But I do think that seed oils and not cooking with extra virgin olive oil is a good plan. And I do agree that trying to eat foods at the wholest form possible is really important so you can get more fiber, more nutrients, because the more that foods are processed, the more all of that stuff is just stripped from it for sure.
Do you know that the other thing that is in the foods, like especially in your fruits, well, actually a lot of them have it, are antioxidants, which help with your inflammation. And your body
Yeah.
needs antioxidants. Part of your metabolism produces oxidative processes, but it's meant to be balanced by the foods you eat. And the
Mm.
antioxidants are in your fruits and vegetables. It's actually in all of the plants, but
Yeah.
just and
Yeah, antioxidants are really important. That's also, I would probably say that's also the other kind of like issue that people are having because their body is overrun with so much oxidative stress from, toxicity, environmental factors, personal stress from just like whatever is going on. There's a lot of different areas that stress, oxidative stress, dysfunction in the body can come from. And if they're not offsetting these things or reducing where it's coming from, but also offsetting it with a proper nutrition that can really wreak havoc on the body and lead to that dysregulation.
very much so.
Yeah,
Absolutely. Yeah. Yeah.
absolutely.
In our healthy eating adventure, and talking with you is reminding me I want to keep talking about it. We do encourage people to be more, you do need to be active. That's good for you. Getting outdoors. I mean, people have a nature deficiency disorder these days because they don't get outside
A
enough.
sun, a healthy amount of sun disorder too. We
Well,
need
even
sun.
just getting outside, your eyes have to look a distance, whereas in here, I'm looking at and you said you go for a walk every day. I think that's so really important that, and then getting to bed at night. Don't take your computer to bed with you or your phone. Just turn it off, go to sleep.
Ah,
All of those things.
I've finally gotten out of the habit of getting on my phone at night, and it's so good. I take a shower, I go to bed, I might do a little bit of reading or like journaling or praying or something like that because I'm a Christian, and then I just fall asleep. It's so amazing. It's so nice. I have my phone like on my desk, not even by my bed. It's very nice.
Oh, that's great. Yeah, yeah.
Yeah.
Do the same.
For
Make sure.
anyone who's addicted to their phone, get off.
Absolutely. And you don't want to, you're sitting there so close to your face. It changes your whole your vision. I'm worried about kids being on it all the time. They do have more they don't have the same distance vision.
Oh yeah, that is something that I've seen. Um, is there higher instances of kids if you've seen this? Because I haven't done this research yet. I just thought about it. Is there higher instances of kids needing glasses or like contacts and stuff like that than before? Do you know?
They don't have I don't know what the incidence is, but they do have more trouble with distant vision if
Hmm.
they're indoors a lot and not getting outdoors. And
Is it like they can't like everything goes blurry after a certain? Because I grew up outdoors. I was not an iPad kid for sure, so I don't
they
have any experience with
decided
that.
it's like me trying to look through my reading glasses and look at the yeah, no, for
Oh
sure.
wow.
Yeah.
Yeah, that's not good. How are they going to enjoy the beauty of the world?
Hey,
That's
there
sad.
on the website, healthyeatingadventure.org, there's some you might like them. There's some of our little videos or when we did presentations on inflammation and on the microbiome and on the different things like that. If because you seem to like that kind of
Yes,
stuff. I'm
for
wondering
sure.
if all of our and if it would help for your clients to read it, so they have a little thing that goes, oh, well, that makes sense to do this, to eat healthily. Hey, you're welcome to. And in the book, there's a lot of articles referenced, kind of like you really seem to like to dig in there. That's what we did in the book also. I'm kind of hoping maybe I'm going to talk to the medical school at Brown. I'm kind of hoping maybe they'll at least give the book to the medical residents because they'd have the science, they'd have examples of the diseases that are caused by not having the right food and why the food fixed them, and then it has all these great recipes. So
Yeah.
yeah.
Yeah. That'll be super awesome if people are able to get access to that for sure. I personally am pretty hopeful for the future of the medical system because for the past like, I don't know, 50, 75 years, it's been pretty rough. People have been, just surviving, living off of medications, feeling terrible. And I'm really hoping that we're able to see this change in the medical system where people switch to treating with medications to treating with lifestyle and nutrition and actually helping people with their lifestyle and nutrition, not just being like, eat better and don't stress as much.
Well, and then the rest of us can, like the kind of work help you're doing, and in schools they could be learning about it. It doesn't have to be just the doctors have that. They do have to point out that.
Absolutely, yeah. Yeah,
Mm,
I agree for sure, but I do think like a doctor is the first thing that someone goes to when they have issues. And if the doctor is gonna either like be like, hey, you should go to this nutritionist who can actually help you improve your nutrition to help, reduce inflammation, improve the
Depending on
symptoms,
their
whatever.
training, depending on
Huh?
their interests, depending
Huh?
on their interests, the nutritionists. It
Yeah, I know.
depends.
That's why I smiled a little bit when I said that.
But no, that's right. And I shouldn't have said that because I think if a doctor just would say how long would it take them to say, get rid of the processed foods, eat more fruits, vegetables, be sure to eat some legumes and whole grains, and be very careful with or, maybe you don't need meat, or be careful with what kinds you choose. And, if the doctor says it, it would be good. Whereas they go, oh, don't waste your time.
Yeah, just take a multivitamin and you'll be good. I
Yeah.
have seen, though, other instances where I think not even just the medical community, but the whole, what is it? What is the word?
Give me a
Like
hint.
the world as a whole, that is not the word I'm looking for, needs to have some change because there are some doctors who do give general advice like that to people, but it's kind of seen as weird or restrictive or bad to try to focus on eating healthfully. You're weird if you focus on going on a walk outside every single day or try to focus or
I'll let
try
you
to implement
know.
healthy
That's true.
habits.
Yeah.
Culture. The culture of things needs to switch.
Oh
That's
my
the word I
God.
was looking for.
I didn't know that that was starting to, people were being, that's weird. That they think we just have to keep doing more of what we're doing. I mean, I hadn't, wow. It's kind of neat in the healthy eating adventure, the number of people that are joining and being excited by it and feeling well. And one of the last group, there were a couple of people in it from Gettysburg, and now they're going to start some programs over in Gettysburg. So that'll be, you said you're in Alaska. It's a little far.
Yes.
I'm just down in Ritzville, Washington.
Oh, cool.
Where are
Closest
you?
state.
Yeah, that's exactly right.
That's cool.
No, so yeah, it is a societal thing, and it's just the same way the standard American diet got pushed on us and the fast foods and everything.
Yeah.
It's we
I
have to,
think fast foods need to change. People's mindset towards food needs to change the availability and what even like if they don't get rid of the highly processed foods, just making them better at least would
right.
help improve people's health because right now the ingredients in the foods like they don't need to be like that at all. Like why are you adding in such inflammatory,
Oh
I'm not
yeah.
going to say any other words,
Now
type of ingredients.
I have to give a because Rip was so generous, Rip Esselstyn was so generous getting us started, and we keep in touch. But he does make he has a plant strong food line, which makes all these things easy to make, but they're all healthy.
Oh, like a like what do you mean? Like freezer foods or like
I'm
meal
not sure. I because I like
packs
the
or
plan, but I think there's some of it's boxed, some of it's bagged, maybe some of it's I don't know if he's gotten into freezer foods, but minimally processed and easy to prepare. It's not like me to push something like that, but I mean, or to advertise for people. But you mentioned it, and so that I think it does exist out there that there's healthier foods that are, you know, easy to make. But like I said, it was not hard making my lentil soup the other day.
yeah.
It's not
And
hard. Also have to stop having people, we have them, that's one thing at the beginning of healthy eating venture, we have them give up. It's hard. It's an adventure. It's not hard.
yeah, that's an important reminder. Yeah, because cooking healthy food definitely doesn't need to take a lot of time. If you like, you maybe plan a little bit ahead of time, just make sure that you have things in your pantry. It's not that hard to cook foods if you have what you need, for sure. Because
And
I mean,
practice.
I'm kind of like a very good example of that. Back when I like talked about I was like working full time, blah blah blah. I still meal prepped every single one of my meals. I had it in a little container. I did not eat out at all because I wasn't eating gluten or dairy, so I couldn't really comfortably. So I had like absolutely no time. I was super stressed. People shouldn't be having lifestyles like that, but I still focused on eating whole foods. So
That's
it is
great.
possible.
Well, and like I made a whole bunch of that soup and I froze a pint of it in the freezer and I have it for a few. So you batch cook so that
Yeah.
you have a few meals. Oh my God, it's so easy to make roasted vegetables. And that pan of roasted vegetables, you can put some brown rice in the bottom, a little bit of water, chop up all those delicious vegetables. We talked about carrots, yams, some onions, some peppers. and then you cook that, and then at the end of it, you put some beans on top and finish cooking that. Plus, put some kale on it, seasoned kale, and it's yummy. But then you have this
That
whole
sounds
dish of a whole meal. I mean, that's a
got
full
all
meal.
of those phytonutrients, different colors, all the fiber. Have
And
you have you noticed any issues? Sorry for cutting you off,
I'm,
but
I'm,
have you
I'm cutting in as much as you are.
I was curious though, when people first start plant-based whole food plant-based diet, sorry, have you noticed that they kind of have to ease into eating that much fiber just to reduce the GI distress like the first like week or so?
Some people do because it causes gas, but there's a whole section in our book talking about how sometimes the first week there's a whole big conversation about gas. And somebody said, just make sure there's a dog in the room that you can blame it on, or yeah, if it's real crampy, yeah. Some people are a little more sensitive to some of the lagoons. Like I think maybe soy. So you start with smaller amounts and increase. But most people, yeah, it's more gas. But you know why? It's because the gut bacteria are making this butyrate. So they're in there making it. Um, and that's where the gas comes from. So you
Hmm.
can also just go, good, my gut bacteria are working. Yay, gut bacteria.
In the beginning, do you think it could be higher because your body's not used to having that much whoa, I thought I could say that word, butyrate?
Fiber,
I
what?
thought I could say that word.
Butyrate. Yeah.
Butyrate?
Butyrate. Butyrate. But
Butyrate. There we go. Okay, I was trying to add an extra syllable in there.
ah,
It's
yeah.
one of those words that you read all the time but don't say.
I was surprised at how, yes, some do. Um,
Okay.
I was surprised at how many more people have less trouble with their bowels
Hmm.
because they're not having the leaky gut anymore. They're not having the crampy gut anymore. Their bowels are moving. They're not constipated anymore. So there's more people that feel better on it. There are some that are a little fartier, but it doesn't smell like the poop, the gas of meat eaters. Doesn't it?
Sulfur.
Isn't that great?
Um, let me see. I had another question. What was it? Oh, yes. I did have a question about like just for like people who are maybe thinking about eating more plant-based foods. How do you prepare lentils or beans or legumes? Probably more so lentils and beans, I think, to help support like the digestion of those foods. Because I know, especially in the beginning, it can be hard for people's body to break down when it's not used to it. So do you like soak the beans or anything like that before you prepare it, or how do you like buy them?
Well, lentils you don't have to soak. The other ones that you buy as dried beans, you do have to soak those, or some of them you do and some you don't. And I admit, I'm not terribly knowledgeable about it because I use the canned ones. I get low sodium canned ones and they're easy to
Oh,
use.
well, that
But
works.
yeah, they work. You don't have to soak them. They're pre-cooked and everything. So you get rid of the part that's a little bit not so digestible or takes longer. But lots of people, you know, that's just me being a little, I don't want to say lazy. I just never quite caught on to it. It's
Oh,
definitely
okay.
expensive to buy the bags of beans and you can soak them overnight and then you can freeze some of them and use them and um
How do you typically buy and prepare the lentils? Because I know if you buy like the raw lentils, I think it takes like quite a long time for them to actually cook, I think. I don't cook lentils much, but I want to get into it more because I heard that lentils are a complete protein. Is that correct?
they are great. Yeah.
I learned
Um,
that in my holistic health coaching practice or coaching certification. I thought that was interesting because people don't talk about that
yeah.
much.
But you don't have to, even if it's between all of the plants, you're going to get all the amino acids you need. So,
Yeah. Combine.
yeah.
Combine. Yeah.
Um, even if they're not all in the same food. But yeah, legumes, the ones last night only took 30 minutes. I think some of them take a little longer. Split peas also. So no, they're easy to do when you just buy them dried. They just don't have to soak very
Oh,
long.
okay.
And
Well, that's good.
well, if they take 45 minutes, put them on, go do something else. Just make sure you pay attention to them.
Yeah.
Some
Don't.
people, some people use, and I haven't gotten into it, the crock pots and the, what are the other ones I'm thinking of? Steamers, something, and you can put, my daughter,
Instapot?
Instapot. My daughter does it. You can take the beans, the dried beans, and put them in and prepare them that way in a Instapot. There's you can find directions for it.
Oh,
So
nice. We use that to make rice because it's you don't have to worry about it boiling over all over your stove.
make sure your hair are in brown rice.
Yes.
You throw away all the really good stuff.
Yeah. Cool. Awesome. I don't really think there's any other like questions that I have, but kind of to end it off, I'd love to end it off with some like actionable tips that you can give to people. Let's say if someone is just getting started, maybe they're dealing with hypertension, diabetes, difficulty losing weight, maybe like joint pain, whatever other symptoms of high inflammation. Um, what are 2 to 3 core food shifts that people should make today?
Oh, it does turn out if they'll just shift that it actually is easier because when it's kind of like when an alcoholic decides to give up alcohol, if he does it a little at a time, he can't do it because the old habits keep wanting to come back in. The salt and the fat, the dopamine centers go, I want my salt, I want my salt, if you keep giving it to them. That's one tip is think about just going, leaving out the processed food and just taking on all your fruits, your vegetables, your legumes, and your whole grains. I think don't be afraid of it. Just, get a nice book from some different people that make plant-based food and just follow them. I'm not sure I'm answering your question. I'm amazed at how well people pick it up. By the first week, they're having fun with it and not having any trouble. Um, we do a cleaning out your kitchen demo, but we get rid of the processed food and just start cooking. That's not doesn't help you very much on that question, but it's
Oh,
not as
well,
it,
you could make that into one of the like the core shift to make for nutrition is switch to eating whole foods for sure, plant-based. I know
but
is what you specifically talk about. And then if
mhm.
there were like 2 other things, either related to nutrition or just in their lifestyle that you see make the best impact in improving health and reducing inflammation, what would be like 2 more?
Well, but it's the whole picture. So, and that's the whole point of it. It's not trying to pick things apart to do this, do that. It's the whole picture. It's, to have a nice portion of the grains, a nice portion of the legumes, the fruits and the vegetables. And it's kind of not that hard to include some of it every day. I'm afraid I'm not answering your question or not quite getting it, but
Oh, I was just asking if there were other things that people should focus on implementing, like in their lifestyle, routine, whatever, to help to help to help
yeah.
support that shift in nutrition.
Well, it does help to have a pattern for a well-stocked patterns, a well-stocked pantry. So you kind of have a nice selection of vegetables in the refrigerator, a nice selection of fruits. You get used to some stay in the refrigerator, some don't. You have a selection of beans in your cupboard. You have a selection of whole grains and some potatoes and onions. It's just nice to have a well-stocked pantry, and it's not that hard to do. And that's in the book. Um, that makes it easy because if you've got that. Um, and what else would be nice? I mean, just have fun with it. Make it fun. You know what we find is that couples come in and they say, it's fun cooking together or it's fun shopping together. And they hadn't been doing that. One of them had been doing all the preparation and stuff. So I don't know, do it together. Um,
Awesome. Yeah, I think those are really good recommendations. Make sure you switch to whole foods, keep your pantry stocked, and have fun with it.
And then yeah, for sure, get out, go for walks. Oh, you know what else is fun? Grow a garden.
Oh, yeah. That's like the best way to get a bunch of nutrients if you have like healthy soil and everything.
Yeah,
My
and then
mom would actually I don't know if this is weird to say, but she would actually use horse manure because we had horses. We have horses. I don't live with my parents anymore, but she would use horse manure to fertilize the garden.
yeah, we did too. Do you
Okay. I was like, I don't know if I'm gonna sound weird saying
let it
that.
sit for a while, right?
Huh?
Let it sit for a while.
Yes. Yeah, you let it sit for a while and whatever, and then she would compost foods in it and it would be there for like years and she would turn it. It's a whole thing, but
Oh, you compost. I compost all of our vegetable scraps. Oh, that's the other thing I mentioned. So, I hate throwing away the ends of the carrots or the celery or the outside leaves and stuff. So I put them in the freezer. And then at whenever point I take them, I put them in all those different scraps in a pot full of water, and then I boil it for 40 minutes, and that it pulls out a lot of the nutrients and stuff. And then I use that for my broth. I put it in little containers. Oh, and that's what else I do is I use in when I'm not using oil, I you can put it in ice cube trays or little teeny containers, and you take one of those and put it on the pan instead of a glug of oil. Put it on the pan with your vegetables. La la. So that's a fun
yeah.
thing to do.
Yeah, I haven't heard of that before. So is it like the ends of carrots, maybe like broccoli stems, stuff like
Oh,
that?
anything. Yeah, all of
Nice.
yeah, and it doesn't seem to have a particular, it's a very neutral taste, really, but you've gotten all those vitamins from it. You know what else I would suggest in getting in it? Have fun with the spices. We didn't even talk about the spices. Boy, some of the spices are really anti-inflammatory and great for you.
What are
Like
some of your favorite spices to use?
turmeric, I like them all. Turmeric, ginger, and they're all really good. Um,
How do you use turmeric in cooking? Because I personally, I'll make it this anti-inflammatory drink with ginger, turmeric, orange. I'll add like a carrot in there, um, and something else I can't remember. And then I mix it up, and then I kind of drink the juice type of thing. But how do you? Because I don't know how to cook with turmeric personally.
you just
I don't know
shake
what
on.
to add it to.
Just shake it on. Like I didn't use it last night in my bean soup, but in my lentil soup, but you could. Um, do you ever follow recipes?
Sometimes I tend to just cook whatever I want, though.
Yeah, that's lovely. So that's great. So sometimes just try putting a little turmeric in because you like the flavor. It goes well um with the things that you mix together. Just try putting it in and see what you think of it.
Oh, okay, I need to do that. I don't know. Does it go well with like I use Italian seasoning a lot with like vegetables personally.
Yeah.
Does it go with Italian seasoning or what does it typically go with the most?
Is there ever a does it go with?
I'm always
Well,
concerned about the tastes not working.
turmeric gives you more of a sort of Eastern spice, Middle Eastern type spice, so that and so that kind of go that direction with those. Uh,
Hmm. Yeah, I'll need to start incorporating that more for
hey,
sure because I know turmeric is really, really anti-inflammatory.
yeah. Well, okay, back to the book. There are Chef Nick does a lot with the spices and talks a lot about them and tells you which ones go nicely together and everything. Rachel,
Oh,
you might
nice.
might have to get the book, Rachel.
Yeah, I'll need some recipes, figure out how to use turmeric.
Yeah, he does. He has great recipes in there for all
Awesome.
sorts of things. Yeah. And not too complicated. He's got a cooking with kids chapter, which is fun.
Oh, nice. Yeah, it's fun. Awesome. Well, I've enjoyed our conversation today. I think we definitely hit on quite a few important topics, a little bit of a discussion of our differing views. So thank you for being on my podcast today. Is there anything that you would like to leave my audience with?
Oh my. I've given him everything.
Putting you on the spot.
Yeah. Um, no, I think really I think the whole food plant-based, you should really give it a try. You know what? Go ahead and give yourself time to cook and enjoy your meals. Put that back into priority. I mean, what's more important than our health? And here's the thing. If one of my patients was telling me, so now my daughter brings her friends in and they stand around the counter cooking with me and talking. Like it's like that husband and wife. It really recreates community also. It's not just making a meal, it's recreating community and
And
doesn't
that's
have.
how it used to be too.
Exactly. Yeah.
Yeah.
Family can help. The grandkids get in there and help me. The Trillium can make marinated tofu shaken in the ginger and the soy and this. It's really fun.
Yeah.
I want to thank you for having me. Thank you very much. And I
Yeah.
love that you're really emphasizing a very holistic approach, not just whole food, but our lifestyles. I think it's so important and I really appreciate it.
Absolutely. Awesome. So, thank you for everyone to listening to this podcast episode as well. If you enjoyed this episode, be sure to follow it for more conversations like this. And you can connect with Dr. Elizabeth George to learn more about healthy eating adventure, as well as get her new book that's coming out through the links below. I'm going to have all of the links below to her website, social medias, whatever else she wants me to link. And if you're ready to go deeper into your health journey, um, definitely shoot me a message, shoot Elizabeth a message, whatever you desire to get the proper support in helping you and healing your body and supporting your health. Because as Elizabeth has said quite a few times in this podcast today, what is more important than your health? All right, until next time, have a wonderful week.